Now to a story about access to health care in underserved metro areas and what happens when it goes away. A Fayette CARE Clinic is shutting down over funding, leaving a gap for patients who depend on it. Our Brian Unger joins us live from Fayetteville to tell us more about this closure. Brian, good evening.
Good evening, Sharon. Here in this quaint setting, the Fayette CARE Clinic, here doctors and nurse practitioners treated more than 1,000 patients last year. And for many, it wasn't just convenience. This was their only access to health care. Now, with funding gone and the doors about to close, those patients will be forced to go elsewhere.
As the clock ticks down, CARE Clinic isn't seeing more patients. Staffers are packing it in, dispersing equipment, wondering what's next for patients. What happened here?
What happened here? Money became more and more difficult to obtain. And I had a board of directors that had been doing this for 20+ years, and they just got tired. Tired of trying to just recreate the wheel on how to bring those funds in.
The clinic is funded by grants, fundraisers, and donations. For more than 20 years, it relied on a patchwork that grew harder to sustain. Without state and federal dollars, CARE's doors are closing, similar to closures at other hospitals and urgent cares in South Atlanta.
We're all seeing the same kind of patient.
Who is that patient? How would you characterize
that? Is the person that's living 200% below the federal poverty level without insurance, that can provide us proof that that is how they're living.
I was absolutely at a loss as to how I was going to handle the situation.
Lori Breckenridge's mother, Lynn, suffered a catastrophic illness, and after moving her to Georgia, she relied on CARE Clinic for her mother's treatment. She credits them for saving her mother's life.
They had the opportunity to save her life the first time. She had a massive bleed out event where she was bleeding internally, and they intervened. They helped us get to the specialists and everything.
Providers here are referring patients to a clinic in Peachtree City, where they'll need to rebuild a medical history if they're eligible for treatment.
The challenge will become more challenging.
For Geneva Weaver, who has devoted so much of her life to this place, the closing is personal.
This is where my heart is. I can't say anymore. Not about that. Keep your ears open.
Good luck to you.
Thank you.
Now, the clinic to which patients are being referred to is about a 30-minute drive for most people from this clinic. Now, if you don't drive and you are seeking just basic care, even that can be a challenge. Sharon?
A challenge indeed. Thanks for sharing the story, Brian.